And thank you for joining us tonight for Staying Physically and Emotionally Well This Winter. My name is Laura Allen, Associate Director of Programs for Can Do MS, and I will be your moderator. Our speakers this evening are Denise Bruin and Lucy Carrier. Denise is a nurse practitioner and is a dedicated member of the University of Virginia MS Clinic since 2010. She is very active in her local MS community, as well as the International Board of MS Nurses, for which she is the president of the organization. Lucy is a psychologist specializing in health psychology. She currently works at the Cleveland Clinic Lou Ruvo Center for Brain Health. Now, I'm going to turn the meeting over to Denise. Welcome.
Thanks. Thanks, Laura, and thanks for everybody that's tuning in tonight. So tonight we have 3 learning objectives. The first one is to define the signs of depression. Second, assess impact of weather on changing mood, physical activity, and social connections as we get into shorter days and colder weather in most places. Thirdly, to identify ways to stay well this winter. So we're going to start off with an interactive poll. So how do you promote your mental health in the winter? You can go ahead and select one of the boxes there or type something in if you have something else that we didn't think of, because we'd love to hear your responses and share them as well. So we'll give a few minutes to do that. Okay. And I think you can see other types. Laura, I can't quite figure that out right now to see the other types, but most of people stay mentally well in the winter by doing different hobbies, which is great. In my household, we like to play a lot of games and do puzzles. Exercise, which is awesome, because just because it's winter and colder out doesn't mean we should stop moving our bodies. Social activities, relaxation exercise, and then other. And again, I'll get back to you on what those others are, because I don't see them right now in the poll. So now we're going to have Lucy go through some emotional wellness tips for the winter.
Yes, thank you all. It's good to be with you all tonight. And so we really want to think about our emotional wellness, a key component of our overall health and wellness and living with MS. And emotional functioning is a big component of that. So we really want to just bring some acknowledgement and mindfulness to what might those changing mood symptoms look like, and really how do we become proactive in managing some of those seasonal patterns that we might see as the days get shorter, the nights and days get a little bit colder. Also to really kind of thinking about overall when to reach out. You know, when do we want to talk with our healthcare team and let them know kind of what's going on. So, all right, I think, okay, sorry, let's see. So some of the first things we want to really be on the lookout for are, what are some signs of depression? What does that look like? That deflation in your mood, sadness, and it can be a collection of multiple different types of symptoms. It can look as though someone is sad, maybe even irritable. You may find yourself less interested in activities that you used to enjoy. Your fatigue may be even more pronounced. There may be some weight fluctuations, changes in your physical movement slowing down, feelings of guilt, as well as changes in your overall thinking skills, or even in more serious instances, maybe thoughts of death. And so a lot of these sometimes can be challenging to separate out from symptoms of MS. And so this is really where we want you to be on the lookout of, is something different? What could be going on, and what's really standing out? So what are the winter blues? This is actually a surprisingly more common scenario than we often think about. And so we think about these winter blues as feeling noticeably sad or down during those winter months. So really kind of when fall starts to hit, really noticing, a little bit of maybe some fatigue or just feeling a little bit, having these brief periods of feeling down. And we often think this may be related to those shorter days and specifically less exposure to sunlight. The good news, though, is that they're relatively mild. We tend to see these symptoms remit after a period of time and really doesn't count as a medical diagnosis. But when we see this become more persistent, more chronic, and really interfering with everyday life with those pronounced mood symptoms, then we start to think more about a medical diagnosis, and that would be seasonal affective disorder that you may have heard of, which is kind of a subset or subtype of a major clinical depressive disorder. And so those are times where we really want you to think, this isn't something we want you to live with. This is really something that is treatable. And so let's think about how we might go about treating some of these. All right. So the first thing we really want to think are, what are your warning signs for these mood changes during the winter? Do you find yourself less interested in things that you used to do, right? Those previously enjoyed activities of maybe you used to enjoy going out for a walk or calling friends. Suddenly you're noticing that's not as interesting to you, or it's just taking so much more effort. Also, you may notice changes in your physical functioning. Maybe the cold weather is a trigger for you in terms of spasticity, pain, maybe even extra fatigue that you're noticing above and beyond what would be kind of considered normal for you, or part of that fluctuation that you experience with your MS. Also, too, are you noticing changes with your eating patterns? Are you kind of drawn more towards specific types of foods, carbs, sugars? And how are you sleeping? Do you find yourself with your sleeping patterns, are they shifting a little bit now that the nights are coming on a little bit earlier in the evening? Do you find that you're a little bit shifting with when you're going to bed, when you're falling asleep? Also, too, this is a big one, right? This is really where our care partners come into play. And so are you noticing comments from others? Like, what do they notice? Are they saying you're a little bit more grouchy or a little bit more withdrawn? That's really important data to take into account, too, when we think about what are some of those changes. So how do we go about combating some of those changes in the seasonal patterns with mood? I think the first place is really knowing your warning signs. What may be characteristic for one person could be very different for you. Specifically, too, when we think about your MS symptoms, they all look different, person to person, your mood symptoms as well. So this is really where we want to think kind of creatively. It gets a little more challenging with the shorter days and less exposure to sunlight, to have perhaps, those cherished walks or time outside. So we want to think, how do we find meaning? How do we find enjoyment in some of our activities? Is it through social connections? Is it hobbies? Are there some interest groups that maybe you can join or get more active in? I really like, too, what occupational therapy can provide, specifically, too, thinking about, activities I used to enjoy doing are a little bit more harder now. And so that's really where having that professional contact can give you some tailored approaches, something that can help personalize the activity to fit what your abilities are. Also, too, it's really key during the winter months to have consistency in your schedule. And this relates to when you eat your meals, those activities, and really important, your sleep schedule. We think that this can connect to some of those shifts in mood, the seasonal shifts in mood, because of some disruptions to your circadian rhythm, which is what that master clock that kind of manages your sleep and other metabolic functioning. Sunlight exposure is really important. This is really a first line treatment when we think about the seasonal mood changes that are a little bit more severe. Thinking specifically, are you getting that sunlight first thing in the morning, within an hour of waking up? Can you sit near a window? You don't necessarily have to be in direct light, but can you be near it? Can you get a little bit of time in the afternoon? Light box therapy is also a recognized medical treatment for seasonal changes with mood. And so this is a really Important thing to bring up to your physician, your nurse practitioner. Let them know you might be interested in it. Would you be a good candidate? That's something they can evaluate. Also, too, this is where Denise is going to start talking a little more about how do we get moving and stretching, but this is so critical, especially, too, if you notice changes in your physical functioning, your spasticity, your pain with that winter weather. It's really important not only for your physical functioning, but also, too, thinking about the mood benefits, the sleep benefits, right, with regulation. And also, too, recognizing talk therapy can be really important. Maybe you need that extra connection, professional kind of assistance to walk through that journey with you to kind of help navigate some of those stressors in life. One thing that Can-Do has recently initiated are these things called Snipe Snacks. And so what I love about this are really these wellness, mental health wellness tips that give you those quick tips of kind of what are some things I can do in a really short period of time. That's probably one of the biggest challenges I experience as a psychologist and working with folks in my clinic is I just don't have the time. You know, how do I incorporate this in? How do I make time for it? And so there's a lot of really great evidence-based strategies that you can implement in a very short period of time, something that is specific to the ups and downs in living with MS. You know, is it sadness? Is it grief? Talking about some of the changes in your thinking. You know, what are some ways that I can maybe bring some organization to that, have some of that downstream benefit in terms of overall emotional wellness. And also, too, communication. We can never go wrong with learning some more communication tips, helping others to understand what it is you're going through physically and emotionally. All right, so let's say you're living with some of these symptoms and you're just not sure. When do you talk to your healthcare provider? When might you bring it up? When it starts to become bothersome, really there's no wrong time to bring it up to your provider, and certainly something they want to know about. If you find some of those mood changes are just not really resolving, they seem kind of persistent, it's happening more and more, it's taking up more and more of the day, that could be a first indicator. Also, too, is it interfering with life? You know, again, some of those winter blues aren't necessarily going to bleed over into day-to-day functioning. You're still able to kind of complete some of those activities. But if you're noticing you're not as motivated to, you know, engage in some kind of cherished activities, your friends and family are really noticing some changes in you, those could be good times to think about talking with your provider, bringing it up, understanding what some of those options might be. And Denise, as a neurology provider, what's that like on your end when individuals may bring that up in your clinic?
You know, I usually try to ask my patients this. It's been very interesting to me over the past decade. If I ask people if they have depression, a lot of times that's automatically associated with feeling suicidal, and not that there's kind of a lot of steps along the way. So I've changed how I ask that. So a lot of times I'll ask, how is your mood? And oftentimes they'll turn to their partner or spouse and say, well, ask them, which can be sort of telling, but correct. And sometimes I reframe it like, you know, what did you do that brought you joy that you're no longer doing anymore? And certainly in the past 18 months with the pandemic, some things have gotten worse, some things have gotten better. I think the things that I've seen improve with some patients is all these Zoom meetings. I have a lot of patients that, because of their MS, had not been to an in-person support group in years. And once it went Zoom, they saw old friends again. And it really just kind of opened their world to the technology that was out there. So there is some silver linings to the past year of things. But I think it's all how you kind of phrase it and what kind of resonates with patients. And I think different genders, different age groups might identify what is under the umbrella of depression, but it's how we kind of phrase that to them.
Absolutely. It sounds like really the approach to starting the conversation, both as a provider and as a patient with your healthcare team, of something's just not sitting right. And opening the door to say, I'm not sure what to do about it, and that's okay, right? You walk them through that as a provider. So
Exactly.
That's really helpful. All right. So let's switch now to one of our polls. So what activities or exercise can you enjoy in the winter, colder months? So take a moment and fill this out for us. All right, Denise, I'm seeing a lot of folks selecting those indoor activities with the colder weather.
Yeah. Okay. Yeah, so this is great. I love these quick polls. So, and I figured out how to look at the other answers. So I'm going to share some of those with you too. So, we talk a lot about how heat and humidity affect people with MS a lot. But there's a lot of patients that love it when it's winter and colder outside. So I'm glad to see that still about a third of you like to be outside. Some of that might be, where you live. It might not get as cold. I don't have MS myself, but I find the cold weather very invigorating. Majority of people said indoor, so kind of transitioning activities they did outside to indoor. Online classes, again, this has been a huge kind of thing that's blossomed in the past year and a half with online classes. So I love that over half of you have enjoyed that too. Seated activities, about 50% of you as well. So this is, I'll go into this as well, but seated activities, whether you don't have the balance to maintain sitting up or if you're primarily in a wheelchair, there's still activities you can do. And then other, water activities people put, they like being outdoors. I have somebody that said earlier that the winter cold weather is their friend, which I love. Dancing in their home, just putting music on and dancing. I love that. So a lot of these things are just really great answers. I just wanted to reflect 1 second while we're here about some of the answers people put for other activities that they do during the winter. Exercise, cognitive games, books, go on vacation pre-COVID, take extra vitamin D, drink more coffee, support group facilitation. So giving back and volunteering can be very fulfilling for many things. Walk outside, baking, jigsaw puzzles. So these are all great things. So moving to the next slide here. And there'll be time for other questions. So if you have other ideas, feel free to put them in the question box. So physical wellness in the winter. For some people, I hear excuses in the summer. It's too hot, it's too humid. And then I hear different excuses in the winter. It's too cold. So there's like this little sweet spot that people say when they can get outside and exercise. You will find, though, in most communities, there are ways, if you don't feel safe or the weather is a confounder to you, to still exercise inside, even during the really hot and the really cold months. But staying strong and exercising throughout the year and finding something that you like to do is so important. So especially now more than ever with the pandemic, it's really important that we keep our hearts and our lungs healthy with regular exercise. So getting our heart rate up, increasing our respirations, it's really important. Clearing all that stale air out. It helps with us to sleep better too, and with our mood. I'm also going to talk a little bit later about diet and supplements in the winter and vaccines, which is a very hot topic right now. So what is exercise? So it is intentionally moving our bodies for a set amount of time. This is another question I often ask my patients, like, do you exercise and what do you do? So shopping at Walmart, for some, might be the limit to what they can do moving their bodies, but for the majority of patients, that's not exercise. So exercise is saying, unless you go to Walmart to walk around because that's safer for you and you can use the cart and that kind of thing, but it's intentionally setting amount of time, whether that's 5 minutes or an hour, to move our bodies. It doesn't need to be a full hour to be beneficial, just like the snacks for mental health. Snacks at exercise can also be very beneficial, especially when fatigue is an issue for patients. A lot of patients have like a Fitbit or an Apple phone that'll kind of jar you to get up and move 5 minutes every hour. So those little snacks, they add up during the day, and that's just as beneficial as setting a whole hour aside. So again, it's raising our heart rates, increasing our respirations and breaths. It's one of the only things to slow down the aging process. So exercise, again, kind of checks off so many boxes. It's moving our muscles in a continuous motion so that eventually things become easier. I see where some people have written in that they have certain muscles that are sore. That's to be expected, especially once you start a new activity. You know, bodybuilders and runners, you know, even if they're the fastest man on the planet, Usain Bolt still runs every day. It's not that he just woke up and could start running. He keeps at it. It's that practice. And eventually things get a little bit easier as your muscles get stronger. I am a huge fan of physical therapy for my patients, not just to focus on specific things like balance or strengthening one muscle group, but also just to get patients loving exercise and what it does for our bodies. But it's really maintaining that and the accountability of continuing to do your exercises once you finish physical therapy, which can be a real challenge. So I have found in my area that there are several physical therapy locations that actually have like a wellness gym, that even if a patient isn't getting physical therapy per se, they're still allowed for a very small fee to go in and use the equipment there. So it might be something you want to look into that maybe you haven't thought of before. Planet Fitness is in a lot of communities as well, and it's very cheap to join that. I think it's somewhere like $10 to $20 a month, which is not bad at all. So again, exercise benefits. It helps from top to toe. So it improves our mood. When we exercise, it releases good chemicals. It feels good. You might hate it at the time, but I promise you, when you're over, you're going to be like, oh, I feel kind of good. I feel kind of puppy. It helps with your fatigue at the time, but it also helps you sleep better because you're more tired at the end of the day too. It makes our bodies move easier. It makes us less stiff. It helps with osteoporosis by helping to strengthen our bones. So even if you can't get up and walk or run, doing light weights with your arms or even doing presses where you move your body up and down and strengthen your upper arms is going to help your bone strength. Again, it clears out that stale air from our lungs, getting all kind of deep down into our lungs and getting all that crud and stuff out. It improves the blood flow even to our brains. So not only does it help with any swelling in your legs and preventing any type of blood clots, but it even gets the blood going in our brain. So that's why we think it also helps with some of the aging process, and with some Alzheimer's studies is actually shown to help decrease Alzheimer's risk factors or even how patients do. It improves our GI movement because when we're moving everything, it increases the flow through our intestinal tract. So you might find that you have to poop after you work out, but that can be an added bonus. I had one patient recently that's been using a new step, which if you have trouble balancing on any type of device, you might find that very beneficial because it actually supports you and it helps you kind of move your arms and legs. So they found that doing that actually really helped with their constipation too. So it's kind of an added bonus. And again, as I mentioned before, it slows the aging process. We all want to be our younger selves, right? So the more that we can help with that, the better.
So Denise, we're getting some good questions and comments from the question box. And I think one that I'm really seeing a theme for is that a lot of folks have gotten really creative with finding some of those gym memberships that may work for their insurance plans, finding those online classes that can also be, I think, really tailored to you. And if you're living in an area where you may not have that gym down the street, I think that's great. Just really speaks to some of that resiliency. In terms of some of the more specific questions, I think could be really applicable for the group. I saw one about timing of exercise. I know from a sleep perspective, it's fantastic. It can really help with regulation. You know, as much as you can do it during the day, I think is great. Really thinking about when you are feeling your most active, when do you have your best energy, right? There isn't really a specific time, but when we think about sleep, at least give yourself 2 hours before bedtime. You know, don't go out and run or do something on the elliptical and then hop into bed. We find that you're going to have more disruptions, but if you can kind of have it a little earlier in the night. Denise, I'm wondering, could you speak to maybe general recommendations for how often or for how long?
I'm sure there's some recommendation, I'm sure, from the American Heart Association, which I don't know off the top of my head. But I try to set realistic goals for my patients because I also find if you bite off more than you can chew and you can't do it, you're going to feel like a failure and not do anything. So, you know, everywhere it says take 10,000 steps a day. So me, again, not having MS, I set my Fitbit for 6,500 steps a day, because if I do that, awesome. And if I go over that, awesomer. So I try to make it a goal that is realistic for me. And if I meet it most of the time, great. So, you know, I think even 5 to 10 minutes, 3 times a week for patients to start, I'm happy with. Sometimes it's different challenges. It's a accumulation of how many minutes during the week that they do. I have some patients that, you know, they live very remotely. They don't drive. They don't have anybody that can take them to a facility. They have really poor Wi-Fi connection. So there's all these limitations. So the goal is they walk through their house from front door to back door 3 times a day. And they try to do that, you know, 3 to 4 times a week. So again, I think it's trying to meet people where they're at so that they can succeed. And then we kind of build off of there. I agree. I think in terms of times of day, I definitely have patients that are night owls. And so, you know, if it works for you, you can exercise, you know, later in the day. I personally like to get up and have my exercise clothes kind of laid out. So that's the first thing I put on in the morning, and I get it out of the way. And then I shower and kind of get ready for my day. If I get up and just keep my pajamas on and laze around, like, it's not happening. So I try to, again, set myself up for success. So I think there's different tips. And again, we all struggle with this, you know, MS or not, but it's even that much more important when you already have something against you with a neurologic condition like MS, to try and stay as strong and to keep fighting as much as possible.
Yes, I think it's all really important to think about it too from just a behavioral perspective, right? You're learning a new behavior, you're putting something into place that you know, may not fit in your daily routine, but as much as you can, like you said, remove the barriers, right? First thing in the morning, right? I don't have to go searching for my equipment and my clothes. It's kind of right there. And so you just increase the chances that can happen. So that's a great,
Exactly.
and one thing too, a lot of people are asking, you know, certainly insurance plans can be challenging in navigating some of that, getting access to physical therapy. The National MS Society has an MS Navigator initiative, and so with that, or program, excuse me, and that can be really helpful with helping to navigate some of those nuances with kind of your coverage and what's available in your specific region. That might help connect with some of those gyms or their special promotions that can also be applicable for you. So.
Exactly. And if you still can't access that, again, on the Can Do MS website, there are these exercise snacks. So one of our very own, Mandy, has put together little videos, little vignettes of things that you can do at home. Some of these are seated. I know some people have commented that they're in a wheelchair and can't, how do they exercise? There's still so much stuff you can do. So this is a great place to start, is with these exercise snacks. So check that out as well. So not only is there mental health, but physical activity.
Mm-hmm. And they also, too, the National MS Society has some pieces on MS for yoga. So something else too to think about.
Yeah, there's a lot. If you Google MS yoga on YouTube, you'll find a bunch of stuff. And there's also like an MS gym you can Google too on YouTube. And there's activities that are also modified so everyone can do it. So as we're coming out of summer, when, you know, I'm still getting a few tomatoes out of my garden, they're not as pretty as the ones earlier, but it can be a little bit more difficult to find fresh fruits and vegetables as we get into colder months. But this is also really important still to get those minerals and vitamins and roughage into our diet. So what other ways do you or could you keep this in your diet year round? Awesome. Okay, so I love it. So a lot of people already know some of these tricks. So winter fruits and vegetables. So oranges are great. Different squashes, especially the really colorful ones, are very abundant in the winter. Frozen fruits and vegetables. I've become a huge fan of this, just always having them around. There's so many things you can do with frozen blueberries, from putting them in yogurt to smoothies or just defrosting them and eating. You get beautiful blue lips from it as well. Soups and broths, you want to make sure they're not too salty. Canned fruits and vegetables can also be good, surprisingly. Anything that's kind of harvested and then stopped in its process is healthy for you. The problem is if things are packaged in a lot of salt or a lot of sugar or syrup. Some people think, oh, this is fruit, it's still healthy for me, but it's really not if there's a lot of added salt and sugar to it. So make sure you read the labels on things. A couple of things people commented on are dehydrated fruits and vegetables. Yep, that's great too. So raisins, plums, prunes, again, good for your GI system. Just make sure you drink a lot of water with them. Some people, yep, rehydrate dried fruit. That's a great idea, especially if you put it in things like smoothies again, or with oatmeal, that can be really yummy. And correct, canned vegetables or fruits are usually as healthy as fresh, as long as it's not in a lot of sugar or salt. So good, you guys are good. You figured out some of these things that you can't just, again, say it's winter, there's nothing there. And bananas are usually found year round, so. Okay, so the next question, okay. So getting a little bit more into diet and supplements. So this is another hot topic. A lot of patients will ask me what supplements they should take, because they are under the impression that their immune system is broken and they need to take things to support their immune system. But it's actually quite the opposite. So with autoimmune disorders, instead of your immune system protecting you, for some reason it's been triggered to start attacking you. So we recommend not taking any vitamins or supplements that are, say, like immune boosters, because that's just kind of putting fuel on the fire, right? I get that people want to do everything they can to be healthy. So there are supplements and vitamins you can still take, but I would definitely recommend that you talk with your neurology team about that. I have some patients that are just really into being as holistic as possible along with their disease modifying therapy. So often they'll send me a picture of the label of their supplement and I'll look it up and tell them yay or nay. Again, it depends on how much literature is out there, as well as there is any evidence that it could interact with something they're taking now. Just because it's natural does not mean it's safe. So definitely keep that in mind. And also because it's a supplement or vitamin and not a prescription for it, you still need to let your healthcare provider know, because there might be something about how things interact. So most multivitamins are fine to take. And then vitamin D, which I've seen a lot of people respond to, that they take more in the wintertime, which is great. Vitamin D is highly recommended. It actually seems to work more like a hormone than a vitamin in our system. And even during COVID, when they were looking at patients, non-MS, but just COVID patients, those that had a higher vitamin D level did better than those with a low vitamin D level. It's very hard to find vitamin D and get enough of it through food. So usually we need to take supplements. I like my patients to be on the higher end of vitamin D. I'm a big believer that it does help with minimizing MS, just from what I've seen over the past decade. So definitely talk with your healthcare provider and make sure you're getting a vitamin D level checked and getting some guidance on how much to take weekly. Also for first degree relatives, this could also be something that might help minimize their risk of developing MS, is their vitamin D level. And then again, diets with that are low processed. So high in fresh fruits and vegetables. And a lot of patients will ask me about, what MS diet is there? So there's a lot of different diets out there that have been very little researched, but written about over the past 50 years. So there's not a lot of science behind it, because nobody is going to really put research money behind finding the best diet. So overall, the Mediterranean diet is probably the best. So it's high in good fats, so olive oil and nuts, high in fresh fruits and vegetables, high more so in fish than red meat. So overall, that seems to be the best diet if you wanted to follow something strictly. But really, the less processed stuff, the better. So if it comes in a bag, a box, or a can, you need to read the label. If you can't pronounce it or don't know what it is, try methylete number 4 blue. Probably shouldn't be eating it because it's not good for you. So, just to kind of keep that in mind. There are still snacks that are healthy. So like Triscuits are wheat, salt, and oil. Much better option than something that is, blue and has some powder on it that you don't even know what it is in terms of your overall health. So it's good to make those choices. And again, everything in moderation. I saw where some people like to eat ice cream and stuff. That's fine. Again, you just can't have, a gallon of ice cream in one sitting. It's all everything in moderation, and again, balancing the fresh fruits and vegetables as much as possible. Okay, and then I think this is my last slide until we kind of get back together. But vaccines and MS, very hot topic. So the National MS Society does recommend that most MS patients, so 99%, receive the COVID vaccine. It is also recommended that MS patients receive the third or the booster shot if they received Pfizer or Moderna. I know that it seems like the data is changing, or the information, I should say, not the data, but the information about this changes day to day. Back in August is when the CDC recommended a booster for Pfizer and Moderna for people that are immunocompromised. So a lot of that does depend on what disease modifying therapy you are on, if you're technically immunocompromised or not. So some of that you want to talk with your healthcare provider. And then there's been more information this week about Moderna booster and who should get that. Again, immunocompromised patients. I'm still recommending my patients to do that. I have heard just in this past week, patients getting some pushback from pharmacies when they went to get the booster, which should not be. It should be on good faith. So I have been writing on my patients, like after visit summary, for them to get the booster shot. We also highly recommend the flu vaccine. We know this is also safe. And then depending on what disease modifying therapy people are on, there might be some recommendations from your healthcare provider about the timing of when you get the vaccine. So if you're on infusible therapy and you got that Monday, it's probably not best to get your vaccines on Tuesday, just to stagger things a little bit. One, because of response to both your medication as well as the vaccine, to kind of know what's what, but also just to kind of give your body a little bit of rest. There is some more definitions on each individual drug's website, but I would also talk with your healthcare provider because there's some opinions about that too, with how we want to keep our patients safe from the pandemic, but also keep them on their medication as they should. Lots of questions coming in about vaccines, so we'll get to those a little bit here. So key takeaways. Lucy, I think this is you.
Yeah, so, a good portion of our time tonight has really been spent on, just the importance of exercise, but really kind of how do you adapt it? Certainly the comment box I've been watching, a lot of you have done some really fantastic things, really thinking outside the box of, how do I incorporate in activity? How do I incorporate in cardiovascular exercise, recognizing this has really long-term implications for prognosis and disease burden, and how do we manage, disability? And so really want to mention that. Also too, right, just as much as we've been talking about your physical health, your emotional health too should also be at the forefront. Being mindful of those mood changes. How might it relate to your physical functioning, your situation, the colder days, less opportunity, access to different activities that you used to enjoy. And so really, again, knowing what your mood triggers look like. And of course, too, we always want to think about healthy diets. That can always be a little bit more challenging with the holidays and maybe not making the best or the healthiest food choices. But again, as Denise said, right, everything in moderation. But also too, those vaccinations are really important in thinking about, again, your overall health and wellness when we think about living with MS and managing and getting through those colder winter months.
Wonderful. Okay, so look at that, we're right on time. So for the last 20 minutes, we can do questions
And before we start, I do want to thank both Lucy and Denise for some great information tonight. I really appreciate all the tips and suggestions that you provided. Now, to our participants, as a reminder, we will ask you to complete a survey that is going to pop up on your screen at the conclusion of the webinar. But first, let's go through a couple of questions. Now, Lucy, I know you talked about mood and depression a little bit. And so one of our participants wrote that she tries to hide or keep secret her depression. She wonders if this is common, and do you have any tips or strategies that you could provide?
Yeah, no, appreciate that comment, and certainly one that we see as mental health providers, right? Really kind of thinking about the stigma that may come with having depression, right? That we think about depression often not only as kind of an adjustment or a reaction to maybe some of the loss that you may be experiencing living with a chronic illness, but remember too, it could also be a symptom of your disease. And I think thinking about it that way helps to normalize it, right? And it's something that we know is one of the most treatable comorbidities in living with MS, and one that can have implications for your physical health, right? You may be less motivated to do some of those exercise routines we talked about, and eating healthy and getting out and taking care of your brain, right? Engaging in some of those good exercises, brain fitness exercises. So really, right, how do we navigate it? And I think that's really where if some of those self-management strategies aren't as beneficial, right? Thinking about the pleasurable activities, some good exercise, really talking with your provider and meeting with a mental health professional, someone that can help understand you, your new unique situations, and really helping to devise a more personalized approach to battling some of the depression and hopefully moving you to a place where you feel more balanced.
Thanks, Lucy. I know that Denise talked a lot about vitamin D and the benefits of vitamin D. And one of our participants asked if there's a correlation between depression and vitamin D. So Lucy, would you want to answer that?
What was that, a correlation between depression
and vitamin D?
I'm not aware of any kind of research studies, and Denise, feel free to hop in on this one.
Yeah, I think that there are. I mean, I think if you were to Google vitamin D and anything that ails you, something might come up, because I think, it's an easy thing and it's been found to be beneficial. So I think the correlation with depression and vitamin D is if you think about how sunlight, not necessarily getting overheated, but sunlight makes us feel good and energetic. And that's also when we're metabolizing vitamin D through our skin. So it is thought that vitamin D does so much more than we really realize, where it can help with depression. It might also help decrease risk of different cancers, and again, decrease risk of certain autoimmune conditions.
Thanks, Denise. I'm going to throw this to Denise. One of our participants wrote that she notices that she sleeps more during the winter months and she has a hard time getting up. Any tips for that?
So that might be a good time to exercise first thing you get up in the day. I get that the days are shorter, and I think that's also, if you think about historically with farmers and whatnot, right, they just did less in the wintertime, so they probably also went to bed earlier, which is why we have daytime savings. But I think if you could get up and do a little bit of exercise first thing in the morning, one, it would probably help with your fatigue, and two, like, you check that off that you already have that done for the day. So I think it's important to listen to your body, but I'm not surprised. It might also be just where you live and it's colder out and your bed is warm and snuggly. So also maybe finding ways that you can stay warm and not just be sleeping. You might just want to look at some of those behaviors. And then lastly, it could also be a sign of what Lucy was talking about with seasonal affective disorder, where you're thinking you're sleeping more than you are, but it's actually a reflection of a decreased mood. And that's one of the symptoms and how it's manifesting. So you might just want to reflect on that a little bit.
And I think a big piece too is really trying to maintain consistency in your wake up times, your bedtimes. That can be really important, especially too if you're noticing some fluctuations in timing of sleep, particularly with evening creeping up on us much earlier in the evening than kind of when we were living during the summer and spring. So that's a big piece. And also too, I like to think, can you structure something enjoyable in the morning? So Denise mentioned exercise, right? That could be something if you're really into exercising first thing in the morning, or right, could you, go out of your way and arrange like a coffee date with a friend? Like, that's something that's going to get you up and get you motivated, like finding that accountability partner too, that may also help with getting you out of bed in the morning when it's a little bit more challenging with fatigue or maybe some sleepiness.
Awesome, thank you. We have to talk a little bit about COVID because it is a reality and it has changed all of our lives. So one of our participants writes, my spouse will absolutely not tolerate me going to a PT clinic or a gym facility until. I know we gave some tips and alternative things that one can do. Can you, Denise, field some suggestions for our participant?
Yeah, I mean, I definitely get it. I think when all of this happened, a lot of patients were really missing going to the gym, and how can they balance that? So one thing you might want to do though is just call the place you go to physical therapy for and ask them what their protocol is and their procedure. When things first started opening up, I had patients with the same question, and they could actually go through like a side door if they were really anxious about being around too many people accidentally. They could go around a side door, and then there was a separate station for the patient to work with their physical therapist one-on-one with nobody else kind of being around. So you might want to look at that. Obviously getting vaccinated decreases your risk, wearing a mask. Hopefully your physical therapist is also vaccinated, wearing a mask. When it's nicer weather out, like right now for most places, sometimes they're doing different classes outside even, because we know just being outside and not in an enclosed space also seems to decrease risk. But I understand, but again, it's that balance, right? Like maybe you go first thing in the morning when there's less people there, and you get out before there's a rush and more people there to feel like things are kind of contaminated. Maybe your physical therapist does Zoom calls. I know ours does. And maybe it's just to kind of do a tune-up on things. So there are different ways to look at that without feeling like you're putting yourself at an unneeded risk.
Awesome, thank you. So we did get a number, when you started talking about vaccines, we did get a number of questions about vaccines and boosters. So is there any movement on boosters for the J&J booster?
So not so much in terms of MS, but last I read was that J&J released information that getting a booster with the J&J, if you got the first one, it was only about 75% effective. Getting a booster seemed within, I think, 3 to 4 months is what they said, increased it to 94%, which made me happy and sad at the same time, because why didn't they release that information sooner? But also knowing that, there's still benefit there, but it hasn't been out yet. The FDA has not approved that yet, but I would assume probably by the end of the year that they would recommend it. I know one other question real quick people asked, are the vaccines protective against the Delta variant? And yes, they do seem to be protective. In a lot of places, the Delta variant is starting to lower.
And we also, Denise, did get a question about the third shot and how that pertains to people with MS. So is there anything different that happens to somebody with MS for that third booster, the third shot?
No. So again, what happens when we get a vaccine is our body sees the vaccine and thinks, oh, that's how, if I come in contact with that, I know how to kill it off. So the thought is when people's immune system are suppressed and don't make as robust of a reaction to the vaccine, that they need a little bit more to have enough soldiers, if you will, in the army if they should be exposed to the actual virus. So the idea behind the third vaccine is that it's just giving a little boost to your soldiers there. I have checked very few patients' antibodies, and it's just more so the patient was curious or other circumstances. It's not recommended to check that necessarily. But that's the thought behind it, is that it just gives a little bit added protection for people that might not have had a full response to the first 2 doses. And then they're also recommending it for healthcare workers. And partly most of that is because we were some of the first ones to be vaccinated in December and January. And now that we're coming up on a year, The idea is just to give a little bit of a boost since we're on the front lines and potential for exposure.
Thanks, Denise. I'm actually going to jump back to the mood and depression piece that we talked about earlier. And one of our participants wrote, I get depressed on and off. Should I seek regular therapy?
Yeah, good question. Certainly something that I would include in your toolbox of kind of managing chronic mood symptoms. Certainly, again, going for that first appointment with a mental health provider can kind of help understand, what may be some of the contributors, particularly if it's chronic and persistent. And therapy, non-medication strategies can be highly effective for managing mood and sometimes in combination with medications too. And again, having some of those professional eyes on you can be, I think, really helpful again to personalize what's going to work for you, taking into account, does your therapist have experience working with chronic illness? I find that can sometimes be a challenge, but if you can find one, I think that can be also just a benefit or an enhancement to your treatment.
Great. I just, this is a comment that one of our participants put in there, and perhaps you can comment on it, because we talked about the healthcare team quite a bit. And she wrote that it doesn't matter which provider you start with, it's who you're comfortable with to start the discussion. So do you want to make a comment on your healthcare team and some good strategies that one can employ?
Do you want to take that, Lucy, first, or?
Yeah, I think we both can speak to that, being part of kind of MS healthcare teams ourselves. And so I think this is really where communication amongst the providers is really critical, conveying some of those concerns, offering suggestions, letting them know kind of what you're working on. But I think as providers in these teams, and the teams can consist of the neurology provider, mental health provider, a rehabilitation specialist, a nutritionist, right? It can really grow. And so with that, it's really key about the communication, right? What is it that you're trying to convey to your provider? And also too, asking your provider, how might you communicate with the other team members? What does that look like? Sometimes it's not as intuitive or straightforward. And so I know that's something I really bring with the folks that I work with of, this is really important. I think we need to loop in your neurology provider, or, is your rehab provider aware of this, or vice versa. I find that can be really critical. But yes, starting the conversation with one of those team members really should be what gets that ball rolling.
Yeah, I think, the main theme is who's on your team. And I think anytime, especially if you switch offices you're getting care at, or new to an area, or even been going there forever, you might not realize some of the resources that might be offered in that particular office. So it's worth the question, like, who else is on the team here? Because there might be things that you didn't realize and hadn't been privy to because you hadn't mentioned it. But like at my institution, we have a nutritionist now with us. We have a neuropsychologist, PT, OT, social worker. So, I mean, sometimes patients don't even realize what all they could access if the issue was identified. So it might just warrant, who else is on the team here? What other services are offered through this office? And if there's not a lot there, then programs like this or through the MS Society can be so beneficial to make you realize, how to access things. And again, now with Zoom and the pandemic, there's so much stuff online that you can access. It really doesn't matter where you live.
Thanks, Denise. So, Lucy, I'm going to ask you one more question and then give you an opportunity to wrap up with anything else you'd like to wrap up, and then I'll put a final question to Denise. So we were talking about depression, and one of our participants wrote that she is experiencing depression. Does she need a psychologist or a psychiatrist?
Great question. I think I've said that for everybody, but I love the mood questions, right? It's on your mind. So the difference, I think, is really where we start in thinking of those two different disciplines. So as a psychologist like myself, I'm not a medical provider. I'm not a medical doctor, and so I'm not a prescriber. What I focus in and where my expertise is with other mental health therapists is in the treatment of mood and behavioral health symptoms from a non-medication perspective, talk therapy, processing, understanding patterns. A psychiatrist, though, their primary modality is going to be treatment through medications. Oftentimes, though, the research tells us a combination of both can be really effective. So, I think sometimes it's a challenge to recommend starting with one or the other. Ideally, if you can initiate care in a center that has both, that's fantastic, right? Again, you have some of that integration, their understanding, sharing with one another. But I say, again, get your foot in the door. Psychiatrists that I've worked with have always appreciated the value that therapy can offer, and vice versa. I recognize, too, that medications have a role in managing mood symptoms, particularly in the context of chronic illness and other medical complexities. So start the conversation, right? Be mindful, just as a final word, of when you're feeling off, right? Is this attributed to your MS? Could this be situational? Could it be, again, that pattern with the winter months? But starting the conversation, sending a note, even something small through your, electronic medical record to your provider, feeling a little bit off. Can we talk about it at our next visit? Or can I put a phone call into the nurse line? I think that's really the key piece. And again, recognizing what are the resources that are available with your provider or your healthcare team.
Thanks, Lucy. I'm going to ask this question, Denise, and I've experienced this with my own parents who are aging. And the question is, how do you get all the doctors that you see to communicate and work together? And I don't even know the answer to that one because I've experienced the challenge, but I don't know the solution.
Yes. So I am fortunate that where I work, we have an electronic medical record. And for the most part, I can pull in what's called Care Everywhere and see notes and labs and imaging done at other centers nearby. But that can be a real challenge. I actually had a patient recently very upset with me because I didn't know she had been hospitalized at a hospital like an hour and a half from here because I got no warning. But she was just very upset that I didn't reach out to her, but I had no clue she was in the hospital. So this can be a real issue, especially when we're dealing with these types of medications in places that don't always understand MS. A patient shows up at any hospital, says they have MS, they give them steroids and send them on their way, is often what I see, which is really sad. So, it can be challenging. So, sometimes the patient has to be an advocate for themselves. Sometimes they're family care members, but you might just also want to ask your provider if they have Care Everywhere and what other facilities can they see in their system. I also have patients that will bring a piece of paper to their visits with me, and it lists all their providers and phone numbers and what drugs they're prescribing, which is very helpful. And then we scan that into their medical record. So it's not 100%, but at least we have some guidance.
So I do want to thank Denise and Lucy again. I thought you provided some great information for our participants this evening. It can be an exciting time. It can be a scary time when the season changes. I know I personally live in Colorado, and the older that I get, the harder it gets to look forward to the cold winter. So, we all have our challenges, but if we can find strategies to be active, to watch our diet, it can make for a better season. So with that, thank you again, Lucy and Denise. I do want to remind you that there are a lot of ways to connect with Can Do MS. You can connect with us on our social media platforms. You can connect with us through our website. And as Lucy and Denise both mentioned, we do have our snacks that we offer through our social media platforms. We're currently offering exercise snacks as well as psych snacks, and we're going to add to that repertoire going forward in the next few months. So look for perhaps some different types of snacks. I'm going to not mention what they are quite yet. I'm going to keep you in suspense and waiting to see what we produce next on that front. So very exciting stuff. And as always, we continue with our monthly programming. This month, we're staying balanced. So we're going to have our jump start on Friday and then follow that with our coaching session and the rest of our jump start and coaching series as the month progresses. So We thank you guys for participating with us, and we encourage you to participate in as many programs as you can. There's lots of opportunities to connect with Can Do MS, and if you do join our Jumpstart and/or coaching programs, you have the opportunity to interact with other people with MS. So it's not just a one-way. We like the webinar to be a very informative platform for us, but the Jumpstart and the coaching platforms are very interactive, where we put you into breakout rooms and you get to meet with other people with MS as well as our healthcare team. So I encourage you to join some of our other programs. Looking forward to next month, we're going to be talking about managing stress. So I encourage you to participate in that webinar as well. And so it's been a wonderful evening. I've enjoyed spending time with you. Thank you very much, Denise.
Thank you.
And thank you again, Lucy.
Yes, good seeing you all.
And my favorite part of the webinar is always thanking everybody out there for joining us this evening. It has been a wonderful hour to spend together and to think about moving into the next season and what we can do to make it a better change. So I would like to say have a wonderful evening all. Thank you and good evening.
Bye, everybody.
Okay.